The unrest in KZN and Gauteng has not only forced businesses into financial ruin, but it's left patients desperately in need of their chronic medication. The South African Pharmacy Council says 118 pharmacies in these provinces have been targeted in the violence. That means that many people are now battling to get access to medication that they simply cannot survive without. For more on this, we're joined by Mr. Vincent Tlala, the CEO of the Pharmacy Council. Vincent, thank you so much for joining us. 118 pharmacies looted and damaged, some even destroyed. Let's start with the most important thing. Were any staff injured? Are they okay after those pharmacies came under attack?
Thank you very much for the opportunity to speak to your viewers. At this stage, we have not received any reports indicating that any of the staff members have been affected. It is mainly the pharmacies, the building themselves, that have been affected by this carnage. What we've received, the report at this stage, we're looking at 120 plus pharmacies that have been affected, where the stock were wiped out from the pharmacy. Because initially we had thought it was mainly the front shop, but now we understand the carnage is such that they even took medicines, including COVID-19 medicines.
Vincent, that's one thing that worries me is now there's so many medicines and drugs that are out on the street, unregulated. That's a big concern.
It is a big concern to all of us. I think the advice we could give to the members of the public: one, never to use any medicines that does not come from legitimate sources, from a pharmacy or any of the healthcare professional. We advise against such because medicines, they are not ordinary commodities. They need to be stored under good storage conditions. So once medicines, in particular COVID-19 vaccinations, are out of the fridge, they have no good use to any person. So we advise against any member of the public being sold such medicines. So whether it be vaccine or ordinary medicines, members of the public, if they do come in contact with such, they must report to authorities. And if you do get those medicines, we ask that you then send them back to a pharmacy where they can be disposed of properly.
Pharmacies, arguably the most convenient sites to access chronic medication. So you just focused on COVID-19 medication, but what about those patients who need chronic medication and are in the areas that are affected? How do they get their meds now?
We are currently in touch with other statutory councils, the sister councils, Nursing Council, Health Profession Council, the Office of Health Standard Compliance, together with the SAPRA. We should, in the next week or so, issue a press release around that and do a press conference as to how we're going to assist the members of the public. With the comfort we draw that is that there are still pharmacies that are open, that where people could get the supply, but we will issue directives sometime next week around how to assist these chronic patients.
Vincent, there are pharmacies that are still open, but as we've been seeing and as we've been covering throughout the morning so far, the supply chain is severely affected. And I'm told that some of the wholesalers have also been burnt down. So how are those pharmacies that are open going to get some supplies in?
There is an engagement with the Department of Health. Just yesterday, I was in touch with one of the what you call retail chain wholesale pharmacies. They are intending to fly some of medicines through to KwaZulu-Natal as part of making sure that the supply is not interrupted. There will be an engagement with the societies to make sure that the stock is shared among the pharmacists.
What about medical records, Vincent? Are any of the medical records that were held at pharmacies at risk of getting out into the public?
What we understand says most of those medical records have been destroyed. We also, again, have advised all our pharmacies to, one, report those matters to the police, report to ourselves, and also make sure that wherever the records are still intact, that those records are being kept safe. Our advice is that And most of these pharmacies would know their patients, would be able to redirect these patients back to their doctors so that they can get the necessary prescriptions.
Yeah, my concern was the medical records getting out to the public, but as you point out, an even bigger concern is that we've lost the records completely, and so we won't be able to keep track of what's being given to patients and what chronic medications they're on, etc. Vincent, thank you so much for joining us. Vincent Tlala, the CEO of the Pharmacy Council, speaking of the impact that the violence, the rioting, the looting has had on pharmacies in KZN and Gauteng.